have difficulty remembering things? Are you finding it hard to concentrate? Sometimes these symptoms are not the onset of Alzheimer's disease, but a thyroid problem. Dr. Stephen Hotze is the founder of the Hotze Health and Wellness Center, and he's here to explain all of this. I was thinking it was just on overload. We're all on overload, multitasking, over multitasking.
Do you know anybody that has that problem?
Me? Yes, I do.
Kids, husbands, families, everything.
Right.
Alzheimer's, interesting. You know, we see a lot of ladies that come into the Hotze Health and Wellness Center that say, I'm having difficulty remembering things. I can't think clearly. My behavior's changed. Do you think I have early Alzheimer's? My mother has it. Now, these are women in their 40s or 50s.
I call it sometimers. Sometimes I can remember things, sometimes I can't.
Well, this is a common problem in women in midlife and in men too. And it progresses. It doesn't get better.
Really? So what is the problem?
Well, the problem routinely is a decline in your natural occurring hormones, particularly thyroid and your female sex hormones and the male hormone testosterone.
Right.
Interesting, Alzheimer's disease is a change in mental thought processes, memory, and behavior, and it's progressive. And it ultimately leads to death in old age.
Right.
It's senility or dementia, we used to call it, you know.
Right.
What causes people to get that? Well, several things can cause that. We mentioned the hormones.
Okay.
Drugs can cause that.
Really?
The common drugs like antidepressants, the sleep medications that are commonly given out like candy by doctors.
This is with Alzheimer's.
Right. The anti-cholesterol medication, Lipitor and Pravachor and Crestor, and all these have a problem with memory loss and global amnesia. So a lot of times people get on these medications, and the next thing you know, they can't think clearly. They go to the doctor. They go, well, you got early Alzheimer's. They give them Alzheimer medication. And the next thing, they're on a whole polypharmacy of drugs.
But it might not have been Alzheimer's at all. It could have been your thyroid.
Well, it could have been very simply your thyroid. And symptoms of thyroid occur or can be described when you have loss of energy, inability to focus or think clearly, depressed moods, poor sleep habits. Then you get joint and muscle aches and pains. Fibromyalgia is a common symptom of low thyroid. But these are symptoms that oftentimes you go to the physician to have addressed and goes, well, your blood tests are all normal, and they put you on a medication like antidepressant or sleep medication or antipsychotropic medication, which make the matters worse.
Right. So what exactly is hypothyroidism?
It's a decline in your natural occurring thyroid hormone, which is made in the neck. The thyroid hormone governs your body's metabolism. The metabolism you want to keep up is the brain metabolism, right?
Right, that's right. And now, why is that overlooked so often?
Because they rely strictly on blood tests.
I see.
And
but that doesn't show up on the blood, but you have to order that blood test.
Well, the reason it doesn't show up because the blood test is so broad in the range that 95% of the people always fall within the range, so they miss the diagnosis because the diagnosis is a clinical diagnosis. In other words, you have to listen to the patient and ask a series of questions. And nowadays with HMOs, doctors don't have but 5 minutes to do that.
So is it enough then to ask your doctor to do this specific test and look at your thyroid levels?
Well, I don't think that's enough. I think what you need to do is find a physician that will listen to you. My recommendation, go to our website, hotzehwc.com. We have a questionnaire in there on low thyroid. Go through the questionnaire, read my book, Hormones, Health, and Happiness. We have questionnaires, and you can find out whether or not you have the symptoms of low thyroid. And if you have the symptoms and you're in midlife, then you ought to have a therapeutic trial of some thyroid, which is safe and effective.
Right. Now, there's a difference, though, between synthetics and the bioidentical.
Right. And we recommend Armour thyroid, which is the bioidentical hormone rather than the synthetic. And why? Because in our experience, after seeing 12,000 patients, it works.
Right. I have to tell you, I was talking to a woman the other day at a bookstore, and she says, I just forget my words sometimes. I can be mid-sentence and not remember the word. And that was me. That was me. And I said, have you checked on your thyroid? So is that pretty common?
That's very common, very common. And a lot of the folks that are watching the show today can identify with that. I guarantee you they can.
All right. Thank you, Dr. Hotze, so much. If you want to know more information on the Hotze Health and Wellness Center, log on to hotzehwc.com or call 877-698-8698. Up next.